Now, eyes on that travel bubble with New Zealand, and to tell us how he's helping with the reopening of international borders, we're joined by Maher from OnePassport. Michael, good to talk to you this afternoon. Let's first start with your business there and what you're doing.
Well, OnePassport is a mobile credential. We specialise in helping mobile workforce in highly regulated industries to be able to move around, such as doctors moving between hospitals, aged care workers, miners, construction, lecturers in universities, those kind of people. And as part of our work, we have an immunisation passport, which, because a lot of the industries who work in, they have flu shot requirements, Hep A, Hep B, drug and alcohol testing, a lot of pathology mixed in there as well.
So Michael, where do you stand when it comes to this travel bubble debate? Are you talking with the government and the states about how it should work?
We are certainly talking to different levels of government, as also different parts of government, because unfortunately government doesn't always work together. Different departments work independently, and then also talking to the airlines, including Qantas. I think we need to open up the bubbles. I don't believe our experience, and we're part of a network called the COVID Credentialing Initiative under the Linux Foundation out of New York. And I don't believe that the vaccination will be the arbitrator of international travel for some time yet. Rather, I think a negative COVID test result, a recent negative COVID test result, will be the arbitrator. So it's interesting to see the discussion.
Yeah, so as you say, you're talking with governments, also with the carriers. Just perhaps outline to us what are the logistical obstacles ahead, because I guess if you're talking about screening these passengers as you open up travel, these logistical hurdles are quite large, are they not?
They are, and so if you've seen, watching the news over even the last week, a week ago the federal government said that we won't return to regular travel till 2024. And then the health minister backed it up by saying, even if all Australians get vaccinated, we still mightn't open up the borders because we'd have incoming passengers, probably 1,000 a week who are positive. But then yesterday in Perth, the Prime Minister said, we're looking to open up as soon as possible for commercial travel and important events such as funerals. So I live in Melbourne, and we joke around that if you don't like the weather, wait 5 minutes. It almost seems to be the same with articles on or announcements about travel. The biggest challenges are vaccinations usually done in hospitals and healthcare. So in many countries that is public, whereas pathology, which is test results, is frequently private. There's a big difference in the IT systems used by public and private. And so even when large organisations like the International Airline Transport Association, IATA, talk about having a travel pass, and they're going to build an international network of hospitals and pathology centres so that they can have all the test results and vaccinations. The vaccinations bit's the hard one, because a lot of the public health don't have IT that can connect to third parties. They can't export data. So that's going to be a real problem.
Michael, are there any other countries out there that are doing this negative test credentialing well that we could replicate?
There is a single global network that I know of, and it's called the Global Diagnostics Network. There's 9 providers around the world, and they're about the only one which has a global network. It covers about 85% of the world's population for actually doing pathology tests that you can record the data. Because if you look at it 12 months ago, if you went and got immunisation, be it a vaccination or a serology, a test done, the results were written in by hand into a little yellow book by your doctor. There was no verification, there was no QR codes. This has all happened in a rush in about a 12-month period. Then it became an SMS. Then people started forging the SMS. So if it was a serious matter, you went to the doctor. They took the sample, they sent it away, they got the results. Yes, it's the same guy sitting in front of me. I'll write you a letter similar to a prescription. But now you can buy that letter online, upload it into Adobe, and you can have your own letter in 5 minutes. So the holy grail now is an end-to-end chain of custody verified response. But there aren't many who can do that. Thankfully, Australia is one country that can, and that we're part of a network which can do it around the world. But it's much easier than the vaccinations.
And Michael, what are your thoughts on the vaccination rollout as it's progressing in Australia at the moment? Obviously, it's become quite political, but even today we've had economists warn that this is a potential massive hit to the economy if we don't get it right. So do you have your own concerns as to how this is developing?
I think the key now is to be flexible, both as a consumer as well as the government and the healthcare services. I'm sure that the government is receiving expert advice, and that's why the message is changing so frequently, because this is a random event, and so there isn't a guidebook for it. So even the medical experts who are telling the government what to do, it's going to be a while, but we need to start opening up for commercial reasons. A big one, for example, is international education. It's our third biggest export in Australia, biggest one in Victoria. Yet difference to mining and agriculture, for example, is that the consumers come here to consume the product. So if we turn off international education, same as if we turned off mining or farming, it's lots of us Australian citizens who are damaged in the process, from job losses at universities and colleges through to Australians who've got a negatively geared investment property that's rented in the international education space, through to hospitality staff, to hospitality providers who just can't get enough staff because the usual international students who would fill those jobs aren't here. So we have to change our thinking a bit. Sometimes in the press it talks about we either have Australians come in or we have international students come in. I think ideas like that are incorrect. It's not a either or, it's a concurrently we have to bring both into Australia for different reasons.
And do you feel as though perhaps this is going to be a long-term event, perhaps even to reach the point of essentially the majority of the globe being vaccinated? There's speculation that we'll continue to receive or need the vaccination yearly, much like we perhaps do with the flu. So therefore, for services such as your own, and more broadly, verification of that vaccination, do you anticipate that this is going to go on for years?
I believe that this is the new reality. If you have been working in certain industries or you travel to certain countries, especially developing nations, there are requirements around vaccinations and test results on an ongoing basis. This is the first time that it's become for all of us. So that's a rude shock for a lot of people. But it's not new if you live in certain parts of the world where mosquitoes cause malaria, for example. This was part and parcel of living there. You're right in saying, like, over the last 24 hours, the Pfizer CEO has said that chances are, and as they get to understand the vaccination rollout better, that you will need a third shot within 6 months of being vaccinated, your initial vaccination. And then you'll need an annual booster to go with it. So this is the new reality for us. From flu shots to COVID responses. I don't think this is the last time this is going to happen. Bill Gates has been talking about pandemics as being the biggest threat to mankind for a long time. I don't think this is a 100-year event. So I think this is our new reality.
Michael, just quickly before you go, you did say there the government changing their mind every 5 minutes when it comes to that timeline. But if you had your way and you had all that technology in place when it comes to those rapid tests, what sort of timeline would you be looking at for opening those borders?
I think we could do it within the next 6 months, because we can actually put in processes that before you fly and once you arrive, you have a double test. As with anything in life, there's a risk reward involved. But if you have someone who has a recent negative COVID test within 72 hours before flying, and when they arrive in Australia, say at the airport, they have a pinprick test or a different kind of test that they can do much quicker, and they stay isolated until that result comes out, which is typically within 24 hours, they should be able to then enter the community. We should be able to operate like that. Singapore's been doing that for a while now. We should be able to do that as Australia.
Michael, thanks so much for joining us with that update this afternoon from OnePassport.
My pleasure. Thank you.